Welcome everybody to Deafblind Information Australia's webinar, Deaf Blindness and Mainstream Technology, Exploring the Potential. I would like to acknowledge the lands from which we're presenting today, the lands of the Whadjuk Noongar people and of the Wurundjeri and Woiwurrung nations. I pay respects to their elders past and present and extend that to any First Nations people joining us today. I am pleased to welcome Liz Doyle, who will be presenting today. Liz is an OT who has a special interest in assistive technology. She's currently undertaking doctoral studies in dual sensory impairment and assistive technology at Swinburne University of Technology. And she works for Deafblind Information Australia on the Deafblind Technology Project as a PhD candidate and researcher. I'm very pleased to have her and will hand over to her now.
Thank you. And I'm very pleased to be here as well. So, my name's Liz and I'm a PhD student at Swinburne University working on a project in partnership with Able Australia. And we're exploring deaf blindness and mainstream technology and what potential that may hold for people with deaf blindness. And so first I'll tell you a bit about the project. And so the aims of the project are to evaluate the utility and adaptability of mainstream technology and how it can support deafblind individuals, and also report on what research exists currently through a formalised literature review that will be a scoping review. And also at the end of all this, take our findings and formulate some recommendations and present these to key stakeholders, which include the NDIS and hopefully other healthcare policymakers, and of course the deafblind community. And so what our project is doing is interviewing people with deaf blindness to find out their experiences with technology and what works and what is a bit of a challenge. And so just to break down the demographics of our participants, we have 21 participants in total. 11 of them live in supported accommodation, 9 of them live in the community with some supports. We've got 9 males, 11 females, and the age range is adults, and they're aged between 33 and 68. So there's a bit of a range there. I think it roughly equal with supported accommodation recipients and also people living in the community. And so hopefully that's a fairly even spread of the population. And we did collect some data from the participants, and that happened over 3 stages, and we've just finished the data collection, so we are able to start doing some analysis of our findings. And the first stage was initial interviews, and that involved meeting the person with deaf blindness, also conducting some semi-structured interviews with them in a setting that was right for them and with the supports that they required to be able to converse with us. And the second part of the second stage of the project was handing over the information that we received from the interviews to the Able Australia project team so they could work with the person and complete some technology testing. So that would be choosing some technology that fitted well with the interview results and testing that with the participant for 6 months or so to see how they would manage with it. And then the third stage was conducting follow-up interviews with the same 21 participants using the same tools as we used in the first interview, and the repetition of the same questionnaires. And so the methodology, which is how a project is organised and how the data is collected, the methodology we used is called mixed methods. So that means that we collect data that's measurable, so numbers and scales that you can measure, and also data from interviews and conversations. So that means we've got data we can measure and conversational data. And when you put those two together, you can see some interesting trends of how people perceive technology and use technology, and what supports they require to use technology, and the challenges they've come across. So it'll be interesting to see whether the measurable data and the interview data yields the same themes, or whether there's some contrast there as well. And I think this type of methodology is useful because of the broad uniqueness of the individuals in the population. Everybody's a little bit different. So I think using two data collection methods is working well for this particular project. Okay, and in any research project, it's good to have a look at what literature already exists in the area. And unfortunately for deafblindness, there isn't a lot of literature. It's quite a small amount, and some of it's of varying quality as well. And but what the literature did find after I did a review of it is that many people use technology that's actually designed for deafness or blindness, rather than deafblindness. So, you know, someone with deafblindness may use hearing aids because that's what they require, but there isn't really anything that's really designed for deafness and blindness together. And we also found that the technology doesn't necessarily fit people's unique needs, because unfortunately individuals with deafblindness as user experts are not involved in the project, in the research itself. So the research is, you know, done by academics or speech therapists or OTs, but not necessarily users with lived experience, which is unfortunate. But on the flip side, there is some promise with something called a tech bundle. So that means one or two bits of technology used together. So a good example is an iPhone used with a handheld brailler that can be connected via Bluetooth. And so that means that a person can you know, send and receive text messages and emails in their phone, and then that's converted to Braille in the brailler. So, you know, combining old and new technology, if you like, shows a good promising outcome for people in terms of their communication and socialization. Okay, so we've just started our analysis, so we've only got some very early emerging results, but what we'll try and do with them is have some formulate some themes, which I'll talk about later on. But first, I've got some graphs, which I'll explain as I'm going along. And so if we divide the tech use categories, tech use that was reported by people into categories, people use deaf-specific technologies, so things like cochlear implants, hearing aids, and people also use blind-specific technology, so that could be braillers or the JAWS program on a computer. And both of those were used by 18% of participants in the study. And the other two categories are smart technology, which is 23% of people reported using smart technology. So that could be a mobile phone with apps or an iPad. And the fourth category that came up was more general technology. So that's things that people use that aren't necessarily classified as specialist technology. So one example of that is someone who wanted to use his PlayStation to play computer games. So that's a technology, but it's not necessarily linked to vision or hearing impairment. And if we go back a few steps with the interviews, what we did do is get people to mention the technology that they used, and also we did a technology questionnaire to find out what their perception is of their current technology use. So, you know, do they find it useful to use? Do they find it difficult to use? Is the technology, do they need assistance with the technology, and how much does it cost, and those sorts of things. And we also talked about their general day-to-day functioning and things like getting out and about in the community or doing things at home, maybe cooking a meal or getting dressed or getting up in the morning. And those were formulated into goals, and all those things were information was given to Able Australia for the tech testing phase of the project. Okay, so the next slide we've got is tech use change over time. And so what this graph shows is a list of technology that people reported using, and how much of that was there a change in the number between the first interview and the second interview. And so some of the technology that's listed on the graph is smartphones, laptops, smart TVs, PlayStation headphones, the recliner chair, that would be another piece of general technology, iPods, DVD players, electric pianos, CCTVs, braille devices with Bluetooth, external hearing aids, different types of hearing aids, bone conduction hearing aids. So all these things were talked about in the first interview and in the second interview. And for anyone that can see the graph bars, there isn't much of a change between technology procurement between the first and second interview. One person managed to acquire a phone from interview 1 and 2, and there was a couple of people who acquired an iPad, and a couple of people acquired some headphones. So there's a few bits of technology that was acquired through the interviews and through the tech testing phase, which would have given us some insight into what people want or need. And just to give you another bit of info from this graph, the most frequently used technology reported was a smartphone, laptop, iPad, or smart TV. And the fifth most frequently used technology was a CCTV. So you can see that that modern mainstream technology such as phones and laptops and iPads are actually frequently used in our cohort of people of 21 people, whereas a braille device was used by 2 or 3 people, and a pen code scanner was used by 1 person. So though there was a bit of a range in our cohort of only 21 people, so not that many, a lot of smart technology was already used. Okay, so some emerging themes from our initial data analysis. The first theme was about social connection and access to information. And so I've just got a quote on the screen and I'll read it out. It says that receiving a smart reader opened up a new world for me, like learning to connect and actually sending text messages. So this particular person was in the process of learning Braille, and so they would, and also had a smartphone, and they were quite a social person, and they felt quite frustrated when trying to read and respond to text messages in the community, because they would be able to receive the text message but not respond to it until they got home via a computer. So I think just being able to socialise when you're in the community and respond to a text message quite quickly was very important to them. And yeah, this technology was one of this person's goals, was to send text messages. And so they managed to achieve their goal with using a combination of a generic smartphone and also the Braille device to send the text messages. And so, yeah, this is a positive outcome, and there's probably other examples of getting access to information, which I think is one of the most important things for people, is being able to access the information they want in a timely manner and not have to worry about, you know, waiting to get home or relying on other people, but also not having to carry around very heavy bits of technology if they need it. Okay, so the second theme that emerged in our data was the need to tailor to individual needs and requirements. And so this person, I've got another quote, I'll read it out. I need to have something that I'm wearing so that I can say when there's a fire alarm or when the oven, how many minutes is left on it, and so that I can find that out. That's my ideas. I don't want to wear all of them. I just want one. So I think the phrase "I just want one" was particularly important for this person because they didn't want to have to carry around their brailler and their phone and their iPad as well. She would have wanted all the technology just in her phone, and so that was the thing that was important to her. And I think there is potential for phones to be able to do a lot of things. It's just human support or tech support to be able to set them up is the challenging thing. And we've also got to remember that these interviews were done during COVID, and so community members were locked down and not necessarily getting all the support they would have got in when we weren't in the middle of a pandemic. So I think this was important to her, particularly around the fire alarm and also using her appliances. So she wanted to feel as independent as possible. And so I think it comes down to being a safety issue as well. And in terms of tailoring to individual needs and requirements, we know that the deafblind community is a unique community and everybody has individual needs and wants. And some people might like one particular piece of technology and someone else might not want it at all. There was another person who wasn't that interested in technology and thought she was too old to learn technology, but she received a piece of technology to help her read her audiobooks, which is all she wanted to do. She didn't want to assist with uploading the book files onto the book via a laptop. She just wanted to read the book. So I think it's important not only to get the technology for someone, but also respect their needs and wants and how much engagement they want in the technology. Okay, so the next theme is about having appropriate and skilled support and the importance of that in terms of human support. And I've got another quote here from a participant. I'm still looking for an occupational therapist to try and support me with this technology. It's a bit hard when there's not many out there that have deafblind experience. And though I can't see the audience at the moment, I may predict that there might be a few in agreement here, because we know that accessing skilled human support, whether that's OTs or speech therapists or deafblind consultants or comm guides, there's just not enough of them around, and the training is can be quite specific, or it's also learning on the job in the case of OTs and speech therapists. And so I think it's important that the NDIS invest in more support so people can have the time they need to learn the technology. And also perhaps there's an education piece in this too for health professionals and others to learn the specifics of deafblind engagement. And this definitely came up with all the participants, whether it was them or their proxy people who assisted them to answer our questions. It came up over and over again that there's just not enough support and not enough funding around for deafblind people to get the things that they need and want. All right, and on the flip side of that is our next theme, which is the underestimation of skills and abilities of the participants themselves. And so they noted that there was a frequent issue of being underestimated in terms of their skill sets and what they can achieve. And at times, staff may have not have understood the reasoning and the importance of people learning a new task when the staff themselves can complete the task. And so my observations were that there just wasn't enough time devoted to people with deafblindness learning a new skill or working towards a goal. And I think that's probably a resource issue and an issue where staff is maybe stressed and there's just not enough time. And yeah, that was something that I observed as well. And so I think it's important to enable people with deafblindness to choose to learn the way that they learn in their unique style and give them the time and support they need. Okay, and beyond the research, so what happens when we're finished? And so just to let you know where we're at the moment, we're about halfway through the project. We've finished our data collection, and so we've completed the interviews and the 3 stages of the data collection. And the next stage will be to analyse thoroughly the conversational data, so the qualitative data, and also the numeric data, so the data that was collected through using measurable tools. And that will go into some data analysis software that's used in research. And those themes I just spoke of, that's the the initial data analysis, but there's a bit of a long way to go yet for me. So we're just putting in our report for Able Australia this week, and the next stage for me is to sit down and do a lot of writing for the next 2 years. And I also want to include autonomy as a factor in my PhD. And I mean, in the sense of exploring people's sense of autonomy and their sense of how much choice and control they have over their lives and over their choices of technology. And so that's what I'll be adding as my my contribution to this research. And I'll probably do a few more specific interviews with people about autonomy and what their thoughts are on that, and also maybe interview some allied health professionals as well. And so getting back to what's written on the slide, the first thing I would love to achieve is a set of evidence-based best practice guidelines. So what that means is creating a set of uniform guidelines based on evidence that, health professionals and anyone engaging with someone with deafblindness can refer to these guidelines as a set of recommendations to use when working with people with deafblindness. So that may include things like communication and also giving the person choice and how much time to spend with the person to engage with them and understand their wants and needs. And so best practice guidelines are used across the community, in the health setting and also in the community disability setting. And it gives people sort of a benchmark to provide, good support to people. And the next thing I think we need to focus on is engaging with the NDIS. And I've written the word pressuring on the slide, but engaging is probably a better word. So I think the NDIS really need to understand deafblindness better and the needs of people with deafblindness in terms of what's on their NDIS plan. And they should also include, the NDIS have got a set of codes for each type of disability, but deafblindness is considered in the complex disability coding category, so it doesn't have its own code. So if we could suggest that that was the case, I think it would firstly acknowledge deafblindness, but also give it its own particular path and funding benchmark. And the other thing that I would suggest in future is to involve people with deafblindness, so they'd have the lived experience and they're experts in deafblindness, and involve them in planning and design of new systems of technology. So it may be designing a better interface for Apple for people whose vision fluctuates if they've got Usher syndrome, for instance. Or it may be changing the haptics for people, the speed of the haptics, so they suit people who are Braille users and rely on haptics and touch to get information. And not only the technology itself, but the systems as well. So it could be the way technology is assessed, the way technology is funded, and the way the NDIS deems technology to be approved for people. It seems like it's a big bureaucratic system at the moment, and there's not a lot of understanding of people with deafblindness and their needs. So we have to consider the systems as well when, when designing policy for people with deafblindness, and also including people with deafblindness in future research. In my literature review, I reviewed in the end, I started with 1,400 papers, and by the time I'd eliminated all the irrelevant ones, I was left with 11. And so that's not very many. And unfortunately, none of them included deafblind people in the planning of the research or as part of the research team. And so I think we're moving into a culture of co-design, which holds a lot of promise for people involved in research. And it would be very useful to have a deafblind representative, 1 or 2 or 3 or even more on the research team for future research. Okay, so I know I was given a bit more time than I anticipated, so I haven't used all my time, but I'm happy to answer questions and go through any specifics of the project if you like.
Thank you very much, Liz. Could we do a stop share for question 2, and then we'll bring that back.
And also I realized I haven't really discussed the tools we use to obtain our data, so I'm happy to go through that if anyone's interested as well.
Sure. That was that was on my list of questions, Liz. So
yeah.
proceed. Your process there, like it was, what did you use, or did you have to end up designing your own, or did you use some already developed tools for collecting your data?
We used tools that already existed, but we realized along the way that there was a bit of adaptation to be had because the tools we started off with had numeric rating scales of 1 to 10. And so one of the tools for an example is the Canadian Occupational Performance Measure. And so that one involves talking about your occupations or what you do day to day, and then rating them out of 10 in terms of your performance, so how you feel you're doing them, and also your satisfaction, so how happy you are with your performance. And that is required, both of those things, to be rated from 1 to 10, where 1 is I'm very unhappy and 10 is I think I'm doing a great job. And so we found fairly quickly that numeric scales may be a bit hard to understand for some people who may not have had sight or language as a child. So we talked to some deafblind professionals, and they suggested we use smiley face scales, which could be converted into tactile by drawing a hand on someone's palm. And also, a lot of people understand smiley faces are fairly easy to understand. So we made the scale shorter, and we had, a sad face as being I'm not very happy, and a smiley face as being I'm very happy. And we also let people invent their own scales, whatever would work with them. So one person used a 5-star rating scale, like how you rate things on your satisfaction with the hotel you stayed in last weekend. And another person used a scale where the interpreter moved her arm from right down low next to her hip, and that was 0, and right up high above her head, and that was 10. So it evolved as we went along with the scales.
Right. Terrific. I will formally open up the quick Q&A to our audience. Should we have anyone in the audience who needs to sign their question, we will promote you to panelists so we can turn your camera on. That's the only way now that we can get your camera on in a webinar. So we'll promote you to panelists. Just put your name in the Q&A so we know whose camera to turn on.
There's also a couple from Meredith in
Yep.
I can answer those ones if you like.
I'll just read them out for the audience. So let's start with, in terms of the technologies that you were, I guess, assessing and monitoring, were there any orientation and mobility devices that people were using?
Some people had canes, which I guess is an older but reliable piece of technology, and some people had the little device that you press a button and there's a laser, and it vibrates if there's a larger object in front of you, so it gives you an idea if you where you are walking along a footpath. So that some people had a try of that, but I don't believe that was funded for anyone in specifically, but it did come up as a technology that was flagged that may be useful.
Yeah. And another question here. Right, so this is a question about your literature search. So how did you find the literature? First, and then how did you eliminate the ones that weren't relevant?
Okay, so the literature I found on databases that are available through universities for journals. And so there's 4 tiers of journals, which are the top tier is very rigorously studied articles, and then it goes down the list. So I went through the database. I went through 5 different databases. So some of them were disability specific, some of them technology specific, and some of them were social sciences, which would have included stuff like psychology and sociology and the humanities. And I also looked at what's termed grey literature. So that's, publications written by deafblind peak bodies. And there were some from Able Australia that came up. And also there was one from the New Yorker written by a deafblind person. So there's academic articles, but also, more generic articles and deafblind specific articles. And so I used something called Prisma, which is PRISMA. And what that does is help to systematically manage the articles and eliminate the ones that are irrelevant. And so the ones that were excluded from my final list were articles about children, articles about deafblindness on its own with no technology, articles about technology with no deafblindness, people who are deaf or blind. So we didn't want those. We just wanted deafblindness. And I think that was the main criteria for my search. And then what the Prisma chart does is in a formal way, it whittles down the articles to the ones that I want to look at that are relevant for my topic.
Right. Yep. And I got a little question to add in there. How did you get around, or was your software able to manage all the ways that people write deaf blindness? So that all the terms that they might use that don't even necessarily include deafness and blindness. So, dual sensory impairment, for example.
Yeah, I started off with a preliminary search. So I just delved in there and looked for every article that mentioned the terms involved with deaf blindness that I could. So there's deaf blindness with a hyphen, deaf blind, deaf blinded, dual sensory impairment. There's big long lists. And so once I established all the terms, that helped with my search, but I was quite surprised how many different terms existed.
Yeah, yep. There's an addition to that original question. So the articles that the final set of articles that you reviewed, would they be available to the public, or would somebody need that university access to find them, or perhaps even a list, reference list?
Some of them may be available. Some of them may be what they call open source, but I can definitely provide a list if people want it to have a look at. I can provide a bibliography of some articles. I'm not sure I can provide the actual articles, but definitely a reference list.
Yeah. So if that person who asked that question, if they could indicate in the Q&A whether they'd be interested in that bibliography, we can organise that if you are. A comment here, it would be fantastic if the NDIS can give deafblindness its own code for assistive tech. Another question here, you mentioned developing a deaf blindness code with or for NDIS. Is there no code currently? So just I guess maybe clarify that point there.
Yeah, the NDIS have a whole list of codes in a big database, and I guess they formulated that codes based on NH and MRC lists of different diagnoses of people around Australia from medical records and things like that. And so diagnoses that have, I guess, a lot more prevalence, something like Down syndrome would probably have its own code because there's a lot of people with Down syndrome. But people with deaf blindness, I guess, because of a few challenges with the definition and also the uniqueness of the population and the small number of people with deaf blindness, there's no code for it. I think there should be, but I guess statistically wise, the NDIS probably didn't think when they were establishing the codes that that was something to consider, because they put it into a code with complex disability, which would include a whole lot of other things that aren't really linked to deaf blindness.
In terms of, this is a question about purchasing technologies. So in your interview process, did anyone talk about difficulty getting approval for funding to purchase technology?
Yes, that came up quite a bit. To give you one example, there was an individual who loved to watch football on the TV. That was their main hobby, and they had Usher's syndrome, so they had previously been able to go to the football and watch it on TV, and their sight started to deteriorate, so they could still read subtitles, but the problem with the TVs are the subtitle size you can't change, which is quite interesting because TVs are pretty savvy these days, but you can't change the size of the subtitles. So what he wanted was a bigger TV, so that therefore the subtitles would be physically bigger so that he could watch the football games with his family. But the NDIS said that TVs are what they call a mainstream item. And so, people without deaf blindness might go and buy a TV. So he should go and buy his own TV. Yet the reason why he wanted the TV was directly linked to his vision impairment through ushers. They still didn't fund the TV. So we were trying to think of other ways around it, like getting him a laptop and plugging the laptop into the TV and watching the football via a computer, so you could change the settings of the subtitles. So these ideas are still being thrown around because I think he needs a solution because they wouldn't fund his TV.
Yeah, yeah. Wow. Okay, there's a couple more questions here, but I'm going to lead into one of them with another question. So I'm curious about the kind of support that happened in between interviews regarding each person's technology. So did they get sort of, what did their service look like in terms of their technology goals?
Okay, so yeah, the goals were formulated as part of our interview, and the goals were based on something to do with participation and how technology could help the person participate rather than just the technology itself. So an example would be learning to obtain the weather each morning on my own. That was an example of someone's goal. And so I think from what we could gather, the achievement of the goal was linked to the support they got. But maybe, Meredith, if you're there, you may be able to attest more to the tech testing itself, because we provided a goal and we also provided some a booklet for it to be for the support to be documented during the tech testing phase. And my understanding is that support workers and able staff, if the person had funding or if there was able staff available, they would support the person to trial the technology and maybe go into Able North and use the technology room with all the, the tech items available. But I think it depended on the individual, and also COVID played a big annoying role in this as well.
Yes.
As we know.
How quickly we forget. I'm going to, so Meredith is happy to add something there. So she's going to come online, join us online for that.
Sorry, I put you on the spot, Meredith.
That's okay, Liz, and hello, everybody. I'm glad you did mention it, Liz, because I guess it was, a limitation of the project was that we did have an occupational therapist working on the project, but they resigned, so we lost that OT and were not able to find another OT. So having someone with that skill set and expertise to follow up with clients did make it really difficult for part. I think at least the second two cohorts that went through, there was less direct follow-up. So there was follow-up in terms of asking and trying to link them with other providers. But I think, Liz, you've highlighted just the lack of services available and skilled services. So even when there are services, and I think particularly having an understanding of Auslan and vision technology, that is a very rare skill set. And I think when you're trying to learn technology, we know that it can be a long, slow process. So yeah, I think it just speaks to the lack of providers available at the moment, which is a lot why I think there was probably less change from the first to the second interview than we would have liked to see.
Yep. I'm going to add a few variations on that question, so you might want to stay online, Meredith. So was the support that anybody did get measured? So in terms of this interview phase, and they got this many hours of support, or their support looked like this, and this, and then this was their particular outcome with their technology. So with that support in between.
Yes, it's Meredith speaking. That was monitored very closely. So yes, for all of the the people in the supported accommodation, the staff were given checklists that were asked to be completed every week. The project officer would follow up every week. They weren't always completed, but they were completed as well as we could get that happening. And there was also follow-up with each participant on a weekly basis, just around what intervention had occurred. So that was all tracked and sent through to the research team.
So Melanie speaking. So Liz, is that something potentially that will be reported on in terms of degree of input versus outcome?
Yeah, for sure. If we've got data, we can use it for sure. We'll do some analysis on it, and that'll yield some findings as well. And just to give you a few contrasting, well, I'll give you a success story actually of someone who did receive some support. All they wanted to do was have the skills and tools to be able to read the weather each day, because that allowed them to get the information to know what clothes to put on and what schedule they would have for the day. And so that was very important to them. And so with the support of being able to acquire a secondhand piece of trial technology to use, and also having a therapist undertaking regular visits, and having a support worker in ComGuide, I think, following up on that quite closely, they were able to not only read the weather, but also ring their family, I believe, and also access the news and the time. And this was through a mobile phone with some alterations to the settings. And so that's a success story of having the right piece of technology, the right formal support, and the right supportive environment as well.
Yeah, terrific. Another question from the audience. You indicated that between the first and second phases, there wasn't an improvement in the use of technology in some instances. Do you think that would have changed if they had immediate access or support for the tech that they needed or wanted?
I think it probably would have, and not having COVID would have helped as well. But I think if we go back to our success story of our person wanting to read the weather, that's an example of someone with an ideal amount of resources and support available to them when they wanted it. So if we had have had that scenario for all our participants, we may have gotten some more stories like that, I think.
Yeah. But valuable regardless, indicating that degree of human support level in and understanding, the potential of their technologies. Yeah.
And because unfortunately not everybody got the support that they required, it does give a good contrast, and perhaps it leads to a few I suppose, what would you call them, outcomes of the research, that if you get the support, you'll be more successful with achieving your goals.
Yeah.
It's Meredith speaking. I think, Liz, it's such a critical point that you've highlighted, the combination of formal and informal supports working together, and that we know that a lot of people with deafblindness really lack those informal supports. And so recognising if the informal supports aren't there, that probably you're going to need additional formal support. Like, we know there's already not enough, but probably it's not just the training, but that ComGuide follow-up, and just having someone else around to make sure that they're learning too, and able to support and help problem solve.
And also having the support workers on upskilled or supported as well, because an OT or a speech therapist might come in for an hour a week, whereas in supported accommodation, the person's with support workers for most, if not all, of their time when they're at home. So it's important that they're supported as well.
Our next one is a question, a very specific technology question around the smart TV request, an example that you gave. So I think it's probably a suggestion for an alternative technology. So with the TV example, had they not considered a wearable option for casting the TV signal directly to a device like the Vision Buddy?
I think we did discuss Google. I don't know what it's called, but it's like Apple TV, but for Android phones. But I'm not sure that his TV was new and fancy enough to be able to do that. So I think he wanted a new TV that was a bit smarter than his existing one, if that makes sense, which had that capability.
Yeah, yep. A question from me again on that. So did the NDIS even consider funding the gap? So this is my regular TV. If I was going to replace it if I didn't have a vision impairment, if I was going to replace it, would cost this much. This is the difference between the two. So NDIS funds the gap, but not the whole cost.
I'm not sure of the specifics of the response that they got from the NDIS, so I can't speak on his individual situation. Yeah, that's as best I can answer that one for you.
Okay, no worries. There's, and again, another question. Were there any clear similarities and differences between the technology used by people living in supported accommodation and those living in the community, living more independently, I guess?
Yeah, so the people that were living in the community, either on their own or with family, generally they were keen on having their phone or iPad combined with another technology, or being set in a certain way so they could use it to its full advantage. Whereas people in the community, people in supported accommodation, there was a bit of a spread depending on their level of disability. Some people, say with congenital deafblindness, may not have the language to use a smartphone, and the flat screen is obviously there's no vibration on any of these. Well, there's vibration on smartphones, but iPads to someone with congenital deafblindness is just a piece of metal, really. And so what they were keen on was stuff that worked in a vibration modality. So it might be a toy that vibrates, or something that they get a bit of vibration feedback from when they use it. So there was one particular person who was very interested in feeling vibrations around them. And so they used to go and stand next to the washing machine and put their hand on the washing machine to get the vibration input. And they found that very relaxing. So that's the type of technology that might be useful for them. And that could be also linked to a goal. But with the people in the community, it was more linked to smartphone technologies and iPads. Meredith, you may be able to speak to that a bit more.
It's Meredith speaking. So, yeah, and again, I'm not as across all the research as Liz is, but I guess anecdotally, I know that one of the participants that did have functional vision and sufficient functional vision to access an iPad, who was living in one of the supported accommodation, it just took having a more robust protector on her iPad for her to actually start accessing it more. So that was a positive. I think one thing that we saw was just having someone come in and look could make, like, it didn't take much adjustment to get people using technologies in the house already that they may not have used much, if at all, before. Just having someone come in actually increased their use of technologies already available there. So I think there's a lot to be gained with just a bit of input sometimes, but also that we need so much more if we really want to optimize people's outcomes.
And some people
Sorry, that's just one really specific example. I probably don't have a lot more to add.
And I just thought of another one where someone loved to listen to music, but the only modulation they had for music was the iPad. And so what they wanted to do, this is a person living in supported accommodation, they wanted to get to the music on their own. And so it was suggested buying a digital radio that has tactile buttons on it and pre-programmed radio stations, and you can add your own music onto that. So it's taken away the flat, unresponsive iPad from their perspective and given them something they can operate on their own, because it's got tactile buttons and it's more suited to their abilities. So it might not be the technology. You've got to look at the goal and the person's abilities and where the technology needs to be focused. And even if that's just how you operate it.
It's Meredith speaking. I think just speaking to that point and the point I made earlier, I think for some of these clients, just the fact that it hadn't been in the NDIS plan, and I expect this is really indicative for many people with deafblindness across Australia, that nobody's thought to consider technology in their plan or just consider an OT assessment, and how much can shift with just a different set of eyes on the situation and what can be achieved. So I think just being mindful of making sure people are thinking about that in their plans. And yeah, a lot of the people that we work with have limited family interaction or family support. So it's who's going into these planning meetings and making the recommendations for what goes in the plan. I think it's good just to be mindful to consider that technology is changing so rapidly, and to make sure that people are regularly, that it's updated and checked. Is there any current technology that could assist this person with their goals?
And also coming back to not underestimating a person's ability as well, which came up as one of the themes in our results. I don't think we would have anticipated that the person with the iPad could operate a digital radio on their own and access the music they wanted to listen to with their headphones via Bluetooth. So it's not just about assessment. I think it's about quality assessment as well, and getting to the thoroughness of the person's abilities and where it starts to go pear-shaped in terms of what supports they need and also what they want, I think is important as well.
Meredith, again, I think that speaks to why these sorts of goals and supports aren't showing up in people's plans, that underestimation of what people are capable of, that people are making judgments around that, and that limits their opportunity to explore and try things.
And it's also hard to get generic technology funded, which like a smartphone or a TV, as we know. And, you know, those things are some of the most important and most frequently used technologies by not only us, but people with deafblindness as well. So it's interesting that they come up as frequently used, yet they're not always funded.
We have another couple of questions. Any recommendations for future development of deafblind assistive technology to decrease the need for multiple devices?
I've got a participant that would definitely give you her perspective on that. I think probably if you take an iPhone, I mentioned that because I know how much accessibility features they've got, and just building more and more into those devices. This particular person that didn't want to carry around multiple devices, one of her challenges was that she could only look at photos in black and white. So she sort of had to invert the photos. But that particular setting, when you turned it on, affected the entire phone, not just the photos. So I think it's little things like individual settings for things and being able to easily access menus. And I think having people with deafblindness on the Apple innovation team would be amazing. Or even just involved in research at a lower level would be fantastic. But it's definitely they need to be included, because that's where you're gonna find out the needs of people.
Yeah. Meredith speaking. Do you mind me making a point on that question?
Go for it.
I'm just thinking of a product called the Deafblind Communicator that I think was developed maybe around the same time as smartphones, the Apple phone came out. And I think, I don't know, off the top of my head, I could be way off, but it was something like $14,000. It was a really expensive device. And it did basically what a smartphone paired with a refreshable braille display would do for something like a quarter of the price. I can't remember the exact costs. But the issue with people with deaf blindness and being such a really small market is the cost of production. If you're selling heaps of them, the cost immediately goes down. And because it's rare that you're ever going to be selling heaps of them to people with deaf blindness, because we know the population of people with deaf blindness is so diverse that for that one device, it's probably going to be a small group, that trying to look at ensuring accessibility of mainstream devices is typically going to be a better and more cost-effective way to go, and just a better way for the world. We're all getting older. We're all going to need accessible devices if we live long enough. But yeah, I think ensuring exactly what Liz said, that there's consultation from the design phase, from the very start. I know I really love this concept I heard at the roundtable conference on accessible information for people with print disability, and it's conceived accessible, not born accessible, but from the very outset that you're consulting with people with the access needs, rather than designing something and then bringing them in and saying, how do we make it accessible?
And even having people in the committee that design grants, even before the funding starts, you know, how do you design a grant to research ABC, you know, having them in the departments that have the purse strings as well.
Mm-hmm.
And just another point on designing items for people and the research that is out there already. It's interesting, when I was doing my review, I mentioned that the bundle of items seems to be the way to go, because if you have the smartphone, which has, you know, a finite amount of features, but if you can top that up with a braille device or something else that connects that, then that, Meredith, you might be right, that might be the way to go. If you have a specific item that can translate into a generic item that everyone knows about, that's an ideal scenario. And also there were a lot of papers, conference papers, which I couldn't include in my review, that had prototyping devices. And so there's definitely a few researchers around that are prototyping items. Let me think of one for you off the top of my head. It was like a smartphone, probably like the thing Meredith was describing before, which included a braille outlet in the device as well. So whether they all get to market is another thing, but there's definitely prototyping going on for deafblind specific devices.
Another comment added on to that is I find the home alert systems cater for the deaf, but not the deaf blind. So there's lots of room for consumer input in that area.
Yeah. And when I went to a technology conference last year, there was deaf products for deaf people, products for blind people, but not products for deaf blind people. So there's two of the markets are separate, but they need to really get together and talk, I think.
I have another question. It might be too early to answer, but I thought I'd ask. So in terms of satisfaction scales, sometimes if somebody has more information or greater insight into a topic, their satisfaction can actually decrease because now they know more and they're dissatisfied with their former situation, not more satisfied. So did you see any trend like that happening, or is it a bit early to say?
Well, the satisfaction scales we were using was more for a person's performance of a particular task. So it might be making themselves a hot drink or something. So I think if we're going to think about the way you phrased your question, again, person with his TV might be an example where he knows now that the NDIS won't fund generic devices. So he may have been left a bit disheartened by that, but I suppose he sort of knows now. It's not exactly linked to any scale, but that might be an example for you.
Yep.
It's Meredith speaking. Correct me if I'm wrong, Liz. My memory is that like the first to the second interview, like the first interview actually got people thinking a bit more about technology and did sort of shift their thinking about what they're using or what they could be doing, so that there was a shift because they did know more. Is that, have I misremembered that?
With the use of technology questionnaires, because there was 2 questionnaires, one was specifically about technology. I haven't looked at the results in detail yet, but just even talking about technology and knowing the technology that's out there, people may have just felt more satisfied even just learning about technology and being exposed to it. But I haven't got the data in front of me, so.
Okay.
Yeah. And to the point earlier about the bibliography, yes, our audience member would like that. And I guess I'd do a call out to the audience if there's anybody else. Perhaps
I can check with my uni, but what I could do is send the bibliography from my PhD halfway report and presentation, so it's a bigger one. Would that be useful, or just the literature review?
I think it was they were interested in the articles that you, like your 11 articles.
Okay. Yeah.
I'll
send that through to you, and you can. Whoever wants it can have it. Yeah.
We'll work out how to distribute that, because I'm assuming the halfway point PhD bibliography would be a lot broader because. Yeah. Anyway.
Well, I'll give you the 11 from the literature review.
Yeah. Okay. And audience members, if you want something bigger than that, those selected articles, and then let us know and we'll see what we can arrange for you. Okay. So I think our questions have pretty much finished. I'm just doing a bit of a quick scan to make sure I've covered everything. So thank you so much, Liz, for sharing that with us today and preparing the presentation and giving us some insights into not only the sort of the research process, but you know, things that people could be incorporating into deafblind research generally, not only specifically around technology, but research generally in terms of co-design and the, you know, I guess the gaps in service and systems that are barriers to people with deafblindness and their use of technology. So very interesting, and thank you again. I would also like to thank our interpreters, Megan and Naomi, and our captioner, Lee, today for their support with access. And we welcome our audience back next month for another series of webinars. So thank you, everyone, and goodbye.